It's 2 o'clock. I'm Olive Martini, and if you're just joining us, this is the Working on Wellness Radio Forum that we do the second Wednesday of every month, and this is brought to you by the Dungeness Health and Wellness Clinic, SQM's free clinic. My guest today in the studio is Jason Taylor. He is an acupuncturist and Eastern medicine provider. Welcome, Jason.
Thank you. I'm happy to be here.
Well, tell us a little bit about you and how you got into acupuncture.
Sure. Well, I came into acupuncture later in life. When I was in my early 30s, and for about 10 years before that, I've been getting these really bad chronic sinus infections. And I was living in Washington, D.C., went to my ear, nose, throat doctor, said, we've tried everything, antibiotics, we think now we should cut out part of your sinuses. And I thought, that doesn't sound good. And as I was walking back to my office, I saw this sign for acupuncture. And I walked in there and I saw this person 5 or 6 times, and I haven't had a sinus infection since. And I'm 51 now, so that's 20 years. So that stuck with me, and I kept thinking about that. And then I started to do some Tai Chi and Qi Gong, which is a movement based on the same philosophy and principles as acupuncture. And eventually, I was talking to my wife, thinking about a career change, and she's like, just go back to school, please. Just stop talking about this, because it has affected me so much. So I went back to school in my late 30s, early 40s, and became an acupuncturist.
So you're based here on the Olympic Peninsula. What does your practice look like, and what conditions do you most commonly treat?
Yeah, so I mostly practice acupuncture. I also teach a Qi Gong class at a local yoga studio, Blue Mountain Yoga. And the conditions that I treat, they range from, there's a broad range. But very often the things that people come in to see me for are pain related. So, back pain, migraines, shoulder pain. I've been seeing a lot of people recently for peripheral neuropathy. So that's like people having pain or numbness in their lower legs or arms, and been having great success with that. It affects a lot of people. It's really nice to help people regain their balance.
Does this work for arthritis as well?
It can help with arthritis, so relieving pain from arthritis. And then there's other non-pain related issues, like insomnia is another thing, or people who have difficulty sleeping. So acupuncture is very relaxing and is wonderful for helping to reduce stress and help people sleep.
So for someone who's never experienced acupuncture, walk us through what happens during a typical session.
Yeah. Well, first off, I like to have consults with people, so people can come in and talk to me for 15 or 20 minutes and get a sense of what I have to offer and see if there's a connection and if they want to work with me. And at that time, I'll show them what an acupuncture needle looks like. They're very, very small. They're about the width of a human hair. So that's helpful for people to get a sense of, like, this isn't going to be, it's not like a regular needle that you get for a vaccine shot, or it's completely a different thing. They shouldn't even be called needles, really. They should be called pins, or I don't know, they're even smaller than pins, really. So that's the first step. And then, assuming that we're going to work together, the person will come in for what I call an intake form, where we'll talk about a lot of things, because, how much time do we get to talk to our doctors these days, right? It's like 10 minutes maybe. But I like to do a full intake, talk to people about all the issues that are going on and see are there connections between your back pain and, like, maybe you're not sleeping well at night. Get a sense of what I think is going to be the most helpful for you. And at that point, the person will hop up on the acupuncture table and receive an acupuncture treatment.
So what does that look like? If you have pain in your back, for instance, where would the needles go?
Yeah, that's a wonderful question, because a lot of people are going to think the needles are going to go right into my back. And that can be the case sometimes, but very often the most powerful acupuncture places are below the knees, below the elbows. And why might that be? People ask. If you look at our brain, it's like it's called a homunculus, which is a picture of, like, what your brain sees your body. Our hands are the biggest thing that our brain thinks of. There's all these sensors. You think we use our hands for touching and feeling and all these things. And the same, our feet connect us to the ground. Our feet help us move, our legs. All these things, these are the parts of our body that we use the most. And as we're in development, that there's connections between our hands and places like the back. Also, we think of our spine comes down, nerves come out of our spine, move down to the limbs. So very often for back pain, I would do points in the hands and feet or legs, as well as sometimes actual points in the back, but it varies.
Okay, so if the pain is on the right side, do you do the right side of the body or the other side?
Well, you're asking the great questions
Thank
because because it's actually often called a balance method. So that means that if someone's having a pain on the left side, I'm more likely to do something on the right side. And again, something that people are like, but my elbow, it's my left elbow. You're putting needles in my right elbow or my right knee.
You mean pins?
Pins. I'm sorry. Thank you. Yes, pins.
When people wonder about the needles, the pins, they don't hurt, right?
Yeah. Well,
Or they can?
we are. Yeah. So we are like, inserting something through our skin, right? Mm-hmm. And I'd say there's a range of sensations that people can get. Very often it is 0 to mild sensation. A needle comes in, it's breaking your skin, and that sensation goes away very quickly within 5-10 seconds. And there are some places, just by where we're going, that are affecting nerves, and you might feel it a little bit, but it's not, again, it's nothing like the pain you might feel from a vaccine shot.
So the needles don't hurt normally.
Yeah. I would say, yeah.
I've seen, acupuncture where they use so many. Mm-hmm. Tell us a little bit about that.
Yeah, well, there are different. First of all, this, practice or this theory of acupuncture is going on for thousands of years, and it's evolved in different countries. It moved from China to Japan to Korea, back to China again, out to France to develop their own styles, and Germany and United States. So there's different theories. Some are, yes, let's put in as many needles as possible. My personal preference is I put in the least amount of needles I think are necessary. Kind of the idea that less is more. So I find that having real targeted treatments are more effective than just throw everything at it. So for me, it would be unlikely for me to do more than 10 to 15 needles to somebody in a session. Sometimes it's only 4 or 5.
Tell us a little bit more about patients that come to you with neuropathy. How do you work with them?
Yeah, so that's within the last couple of years, it's become really my favorite thing to work with people because it has first of all, it affects people's lives. So you have pain or numbness in your legs. And it's very different for different people. So it could be cold pain. It could be feeling like sand in your feet or in your hands. And, if you think about, we all walk, that we move through this world on our feet. And when you feel unbalanced on your feet, that can affect you in different ways. You can be worried about falling. You can, again, be in pain. You can not want to move as much as you need to move. I mean, I feel like movement is really the heart of living a long life, is continuing to be able to move. So when someone would come into me with neuropathy, there's different types of it. Some people come to me after going through cancer treatment and have chemotherapy-induced neuropathy, or people who have diabetes can get diabetic neuropathy, or they call it, if they don't know, people just get it, they call it idiopathic neuropathy. So we talk about what is going on there. And I have a very kind of dialed in protocol now for neuropathy. And I had someone maybe 6 months ago, and she came in, it was chemotherapy induced, difficulty walking. And after, saw me for, I can't remember how many times, say 5 or 6 times, she left skipping down the hall, but being so happy that she could feel her legs and not be in pain. So I say it's been something I just love helping people with neuropathy.
So some people think that acupuncture is just a belief system. Do you have to believe in it for it to work?
Yeah, that's a great question. And, I asked my clients, I sent out an email to my clients, and I got a couple responses asking, what would you like to hear in this interview? And they're like, well, when we talk to people about how acupuncture has helped us, people say, well, is it woo-woo? Is it something you have to believe in? No, it's absolutely not a belief system. There are different, it's been around for thousands of years. And the original way that people found out that it worked was through trial and error. I mean, the basis of scientific method. But they didn't know the actual mechanisms of how it worked. So they came up with these poetic, beautiful sort of descriptions of acupuncture points and what they call meridians, rivers that move up and down your body. But then as we move into this more scientific era, there's been many studies on acupuncture, particularly around pain, but also things like digestion, neuropathy. Well, I've mentioned that already. And there's lots of research in it. And even if you don't believe any of that, two things that I would say is like placebo effect. That's just getting better from something. If getting better is the goal, right? So who cares? At least that's sort of my theory. And then, animals get acupuncture. So horses, dogs. And that was really when I was originally thinking about going back to acupuncture school. Because, my background, I don't think I mentioned earlier, is as a scientist. I was an ecologist working for the Ecological Society of America in Washington, D.C. And I thought, this stuff is crazy. Like, I don't believe it. And then I read some studies on, reducing pain in animals. And I'm like, well, they can't understand what's happening when they put these needles in. Of course, this is working. So I think that answers the question.
So if someone has insomnia, and what you do in your practice is you bring people in and you talk to them a little bit about what kind of problems that they're having. And if they come to you with pain and you also decide, oh, gee, this might be because you're not sleeping enough, how would you treat someone?
Yeah. So pain, first of all, very often, pain and trouble sleeping go hand in hand. And I call this a vicious cycle because you think about it, you're in pain, so you're not sleeping well. Because you're not sleeping well, you're in more pain. And it's like a cycle downward, right? And a lot of things happen, important things happen to us when we sleep. There's a reason that sleep happens. So we produce very different chemicals in our body. Our body repairs itself. And that's not happening when someone's not sleeping. So often what we're going to try to do is, first of all, by getting acupuncture, when anyone gets acupuncture, they're going to have a reduction in stress hormones and are going to most often be able to sleep better. And when they're sleeping better, their pain is going to go down. And again, so this is an upward cycle of like increasing their sleep, decreasing their pain, people feeling better overall.
And you said while we were off the air that your goal is to not have people have to come back. So tell us a little bit about that.
I mean, really. So when first of all, people come to me as a last resort very often. So they're like, I've tried everything else. I thought, why not try acupuncture? And I'm like, well, okay, I'm glad you're here. It'd be a lot better if you came, 2 years ago for that sciatica or that neuropathy. It would take you less time to feel better. But what I like to do with people is, using my, experience of working with thousands of people, is to say, okay, I think this is going to take X amount of treatments. And we go through those treatments. And ideally, at the end of that, the person doesn't have their issue, or it's diminished to a level that they're happy with and okay with. And at that point, people don't need to come and see me forever when they reach their goal. Most of my client base are referrals, so I'd rather people be happy. It's not like a factory where people are just coming to see me every week forever.
So how does acupuncture work from a physiological standpoint? What's happening in the body when those needles go in?
Right. So again, there is quite a bit of research in here, and the reality is we don't really understand exactly what happens with all of the reasons that acupuncture works. Sometimes it's confusing. So, but at its base, I think that acupuncture needles sort of stimulate our neuroendocrine system. So that's a system, that involves hormones, involves nerves. And when these spots are stimulated, again, the ancient Chinese figured this out over trial and error. So I stimulate a point in my wrist, a specific point next to, a little bone right beside my thumb. That might be very good for stress relief. So they notice, okay, if we do that point, it's going to help with stress. And then these are hormones that are moving up and down our body and changing there. Another thing that really happens with acupuncture needles is we are injuring our body, right? We're sticking a little tiny needle and making these micro circulation issues. So our body, what often happens is we get stagnant, we're stuck. So there's something stuck in our body, and our brain isn't really sending the circulation, the resources to that area like it normally does. So by putting a needle there, it wakes up. It's like, oh, there's something here. Let's send out some blood. There's lots of different fluids, lymph, blood, nerve conduction. All these things are happening in that area.
Well, that makes sense. You mentioned that Eastern medicine offers more than just symptom management. Can you explain that a little bit?
Sure. So there's an analogy I like to use. It's like if your car, there's something wrong with your car, your check engine light goes on. And you have a choice at that point. You can, if you don't like that light, you can take your car to the mechanic and have them look and figure out what it is, and then have that problem fixed on that deeper level. Or you can take a piece of masking tape and put it over the light and problem solved, right? You don't see the light. So that's how I hold symptoms. So very often when we get a symptom, it's actually a warning sign that there's something else going on. So like, pain is a symptom. And sometimes we know what that, warning sign is for. It's for a broken leg. But when it comes to something like back pain, it's more confusing. We don't know necessarily why you're having back pain. And what we need to do is figure out sort of what's under this. Why are you experiencing this back pain? And of course, there are physiological, physical issues that can be causing back pain. Or it can be that we're not breathing properly, or that we're not getting enough sleep, or that we are not moving enough through the day. So it's like helping to figure out what those things are.
And you said that you use Qi Gong in your practice. Talk a little bit about that.
Yeah, so Qi Gong is a movement style. It's very similar to Tai Chi. Most people have heard of Tai Chi.
The very slow movement.
Very slow movement. Qi Gong Tai Chi is almost like a type of Qi Gong. So there's thousands of kinds of Qi Gong that are from very active and moving a lot to slow like Tai Chi. And then there's also medical Qi Gong. So sometimes we do it for exercise, and sometimes we do it to help with medical issues. And the principles of Qi Gong are similar to the principles of acupuncture, figuring out what's wrong. So if someone comes to see me for acupuncture, that's me helping you with the needles, and that's great. And for that to work best, you often need to do something else. So I would provide some Qigong exercises for people to do, things that you can do when you go home that are going to help the acupuncture treatment. Again, similar principles. So you're coming for a more severe intervention, I guess I would call it, with acupuncture, and then you're making your own intervention by how you're moving later, which is more simple.
And so that's how Qigong complements the acupuncture, kind of like physical therapy.
Yeah, it's similar. It's like an ancient Chinese physical therapy movement, the medical Qigong component of it. And then again, I teach a class at Blue Mountain Yoga that is, to help you feel better all the time. It helps with balance, helps with physical fitness, helps with breathing. So breath work is part of it, long, slow, deep breathing. Many of us hold our breath up high in our chests. And breathing is the most simple, easy thing. It's free, and it can, for health benefits from learning different breathing techniques are amazing. So that's part of Qigong as well, is this breath work.
So if someone came to you and said, I think I've got arthritis in my knee, and this is the first time you speak with them, tell us a little bit about how you go through kind of honing in on what is actually the problem.
Right, and I'll say that that's a great question, because often people will come and say, I have arthritis in my knee, but they don't have arthritis in their knee, but they have a pain in their knee, or they have something. So what I would do, the label that people come to me, which isn't as important to me, partially because I see this world through a slightly different lens of acupuncture. So I would ask that person into their pain, like, well, what kind of pain are you having in your knee? Does it bother you in the daytime, or does it bother you at nighttime, or all the time? Does it feel better when you put heat on it or cold on it? These are all things that help me think about, what's going to be best for them. So because each time someone comes to me, even if they, again, come with a sore knee, doesn't mean I'm going to do the same treatment for that person.
And that's all part of your consultation?
That's all part of the consultation. Okay. And then someone will come back the next time, and I'll be like, okay, how did you feel? Were you better or worse? Mm-hmm. or the same. Really, those are the three choices, right? It's better, it's worse, it's the same.
And so do you have them come back like once a week, or do you have them come back like in a month? How does that kind of based on the feedback that you're getting?
Yeah, based on the feedback. Typically, again, because people come to me with these chronic conditions most of the time, and it's taken 10 years to get to me. So I ask people, give me, 4 or 5 visits, weekly visits, to get you to see if this is really working for you. And so people come back after that first visit, and often they have a positive report, but sometimes they don't, and sometimes they even have a negative report. But one of the ways that I look at these things is that if someone feels better when they come back, that's good. If someone feels worse when they come back, that's actually good too, because that means this pain, this issue they have had has changed and moved. And that means it can change or move the other direction too.
Okay.
When things stay the same, so if someone comes back and like, well, no, I had nothing, that's the hardest for me to help you with.
Okay.
But if things move, then we can move them. Then that's good. Yeah.
How do you help patients that are like having dietary issues?
Yeah, so that's another common condition that people come, it's usually often secondary actually. So they'll come in, help them with their knee, their back, and then they'll be like, and then I'm also, I'm constipated, or I have acid reflux, or, oh yeah, just as an aside. And so acupuncture can help with that itself. So there are acupuncture points and areas of the body that can help with dietary, digestive conditions. It is a whole medical practice, so it can help with most things. And I also will help people, people like, well, what are you eating? Some of these ideas. There's a whole subgroup within this Eastern medicine of nutrition. So if you're having acid reflux, are there some nutritional changes that you can make based on Chinese medicine? Yeah.
We have some skateboarders out there. If you
I
hear
saw
that
them.
in the background. So Eastern medicine is a little bit different than Western medicine in how you approach insomnia and pain. Talk a little bit about that.
Yeah, so I go back again to some of these issues or things we've already talked about, but we can go back into is of this symptom control, right? So again, insomnia is a symptom often. I can't sleep. Well, is it that you can't fall asleep right when you go to bed? Is it that you wake up in the middle of the night and then can't fall asleep? Or is it because you're getting up to pee a lot? All these are different issues. So if someone comes and just says, I can't sleep, it's not that I'm just going to give you a pill. So that's really a Western medicine or pharmaceutical answer might be, I'm going to give you this pill, but not diving into why actually aren't you sleeping, or what type of insomnia might you be having.
Well, tell our audience a little bit more about Qi Gong and how that helps with acupuncture, so that people have an idea of it's kind of like physical therapy, that you work with someone on their issue, and then you give them some exercises to do on their own, and where again you're teaching these classes. Yeah.
So again, with Qi Gong, it's movement based, and people ask me how does acupuncture work? How does Qi Gong work? And the answer is similar to me. If I get to the root, the bottom level of it, it's all about movement, right? So pain is stagnation. Something is stuck, and we're experiencing this pain. How can we get things moving? So circulation, lymphatic drainage, movement of nerve conduction. All of these things is movement. Acupuncture needles can help with that. And, acupuncture, again, is an intervention that happens once a week, maybe for someone, maybe once a month. Movement, something like Qi Gong, is something that you can do for yourself every day to keep this movement happening in your body. And so we are literally moving our bodies in Qi Gong, which is helping all of our systems move in the right direction. And we are also, I totally lost my train of thought there. But
keep movement.
So, yeah.
So if you feel like you have arthritis, say in your ankles, or walking and moving, it feels better, but
Right.
only for so long.
Right.
So what would you tell someone who is struggling with this as to try acupuncture if they've tried everything else, or if they've gone to the doctor and the doctor says, well, we're really not sure what it is? They'd come and
again,
see.
like those are like the majority of the people who come to see me. Are That's their story, right? So they've tried everything. I've been to physical therapy, I've been to chiropractor, I've been to doctor. They don't know. Nothing helps. So then they'll come and see me, and so my main response to that is there is hope. I mean, there is hope. I've seen some amazing things happen in my career of people who were told that there was no hope. And there is always hope. You can always feel better. You might not get to 100%, but everyone can feel better. And that's one of the great things about acupuncture is, almost to a person. Of course, I'm not going to say every single person who's coming to see me feels better after acupuncture, but I would put it in the high 90% of, even if I can't help them completely resolve their condition, when they leave, they feel like they've gotten something worthwhile for themselves and for their lives. And that might be from the acupuncture, or it might be learning some movement, Qi Gong movements that they can then do every day, which helps that arthritis not become something that prevents them from moving. And I'll go back to the peripheral neuropathy as well. It's like we are moving people. And as we age, sometimes movement becomes more difficult for us. And all that these medicines, these Eastern medicines are about is making sure that you keep moving. And if you keep moving, you're going to live a more fruitful life for the time that, we all have left.
So what are some of the tools and techniques that you teach patients to maintain their wellness between sessions? Is it the...
So the movement, Qi Gong movement is definitely one of them. Other ones are some of these basic things. The basics are really the best. I'll say, these really simple, yet not always easy to do practices. And those practices are breathing. So breathing techniques, just, I give people some breathing techniques, and they're very simple and very easy. And I ask them just to do them every day. It can be 1 minute a day. For some people, that's enough. And you get you into the habit of doing these things. And that you're going to notice a change from that. Sleep. So we got breath, sleep. So many of us in our society with, living against sort of like the natural cycle of light, we have day-night light cycles, and we have electric lights now for a long time. And that really can mess up our system, and we don't get enough sleep. So helping people figure out a way to sleep better. And then the other thing, you hear about this all the time when you go to a doctor, or it's like drink water, right? So you got breath, sleep, water. And I will say that I don't tell people what to do. I help people come up with their own plan of what's going to work for them. Because again, everyone's different and everyone has different desires.
During the break, we talked a little bit about, can acupuncture work for weight control?
Yeah, and so there's you'll see different opinions on that. I don't think that acupuncture, putting a needle in your body, is necessarily exactly you're not going to lose 10 pounds tomorrow from that. And
that's too bad.
Yeah. And, weight is really controlled by our endocrine system. We've got, hormones moving around our body. What acupuncture does is help regulate, one of the things acupuncture does is help regulate hormones. So that I definitely have people come to me for weight loss as their primary reason that they come in. I'm not going to promise them that they can lose weight. And I'm going to work with them to develop a plan. And very often people do lose weight in a combination between, dietary changes, acupuncture, Qi
sleeping
Gong
well,
movement, sleeping well, breathing,
movement. Yeah. Tell us where your practice is, and tell us a little bit about what it costs and where you're located.
Yeah, so my office is located in Carlsberg, close to Sunny Farms and Big Five Sports, for people who have been out that way. And costs vary, honestly. So people come to see me, again, free consult when someone comes to see me is the first thing. And then treatments are $100 a treatment. And what I do with people is work out what do we think is going to be the arc of your treatment strategy. So people know up front what this may cost them. Mm-hmm. And one thing that I absolutely believe in, and that you don't always see in our medical world, be it through like insurance billing or other things, as clarity. So people know I don't not hide anything. There's clarity in what is this going to cost you to feel better, and making sure people understand that.
Okay, so you don't accept insurance, but you go through what you think the treatment is, how long it's going to last, and what expectation people can have.
Exactly. So
Okay.
so making sure that, again, there's clarity involved, and sometimes things also don't work out. Someone comes to see me a few times and they're not happy, or that they decide they don't want to spend that money, and that's, again, clarity is always good for me.
Well, we were talking a little bit during the break. You were talking about how hormones work with acupuncture and Eastern medicine. Talk a little bit about that. You said that your practice before was helping people conceive through
Yeah, before I moved to SQM, I was living in Seattle. And so there, my practice was primarily based on fertility. So acupuncture is very helpful for helping someone get pregnant. Again, we're talking about the endocrine system and hormones and helping people be regulated. And so it's very good for that. And then as I moved to SQM, I still see people who are trying to get pregnant. In fact, just yesterday I had a happy person in my office. And I hear, believe it or not, I see a lot of people from menopause. So also, again, a hormonal issue. And acupuncture is great for helping with hot flashes, or these fluctuations that we can have as we're sort of moving through. The reality is we have different stages in our lives, and in fact, the Chinese kind of like outline these stages in seven. So every 7 years, something different is going to be happening in your body, and so we just adjust to that as we move along. Yeah.
Okay. So if there's one piece of Eastern wisdom or practical advice you'd like to leave with our listeners about reconnecting with their body, what would that be?
Yeah, well, it goes back to movement again. So it really is movement, and preferably movement outside. So we are humans, but we are connected with nature, and so much of our current society is like kind of disconnecting us from nature. So we're watching screens, we're looking at our screens, we're inside. So movement, gentle movement outside, going for a walk, taking a deep breath of our clear mountain air. Those are things that really can make, again, these are like small, little, tiny things. And if we do them every day, they make a huge difference in our lives.
Okay. So your website, how can people find you?
Yeah, so my website is jtacupuncture.com. So you can head on over there and see. That's a good way to find me.
JT, like Jason Taylor.
Like Jason Taylor, yeah, my initials, jtacupuncture.com.
jtacupuncture.com. Well, this is the Working on Wellness Radio Forum, and this is a health education program of the Dungeness Valley Health and Wellness Clinic, SQM's free clinic. The clinic provides basic urgent care and chronic health care services to uninsured community members. And the clinic is located at 777 Fifth Avenue, and they're open on Monday and Thursday afternoons at 4:30. First come, first serve, and it's a wonderful service. And thank you very much, Jason, for coming in and talking to us about. I'm probably going to come see you.
Happy to be here.